We are now on hypercalcemia of malignancy. It's a very important topic that you need to remember that certain tumors, such as tumors of the lung, such as bronchogenic CA, and certain other diseases, for example, tuberculosis, sarcoidosis, and these they may release increased calcium, which eventually leads to hypercalcemia. So, in this section, we're going through the pathology, clinical features, investigation, and treatment of hypercalcemia of malignancy. So, what are the causes of hypercalcemia? In case usually, if a patient comes to you with acute episode of hypercalcemia, we need to remember that acute episodes are treated as if it's simply hypercalcemia. You have to give them fluids, give them phosphonates, give them steroids, so that once this is actually reduced. But then we need to rule out the cause as well. What is actually causing these hypercalcemia? Some of the patients may not really know they have hypercalcemia or not. Some of the cause may be due to local or generalized increase in bone resorption. This is local bone resorption is due to cytokine-induced secondary bone metastasis or multiple myeloma. In multiple myeloma, they increase cytokines which may mimic the function of parathyroid hormone, are called as parathyroid hormone-related peptides, which is actually a function as if it's kind of a functioning hyperparathyroidism. There's a generalized increase in the bone resorption mediated by parathyroid-related hormone-like peptide released by solid tumors, especially the bronchogenic CA of the lungs. This Hodgkin lymphoma may be present. The Hodgkin lymphoma causes hypercalcemia by increasing the production of calcitriol, which is the activated form of vitamin D. This is causing increased absorption of calcium in the gut, eventually leading to hypercalcemia. For example, it may be associated with multiple endocrine neoplasms, which also cause hypercalcemia. In men type 1, this hyperfunctioning of parathyroid glands, which when hyperfunctioning happens, this eventually leads to secondary type of hyperparathyroidism. In men type 2, medullary thyroid carcinoma actually causes hypercalcemia. This is also causing a secondary type of hyperparathyroidism. So what are the clinical features? Clinical features of hypercalcemia are almost similar as in case of other hypercalcemia or in case of hyperparathyroidism. Due to the excessive calcium in our body, symptoms would be of malignancy plus hypercalcemia. For example, sometimes patients know that they have got certain problem and they tell you on history. But sometimes the patient just presents with an acute hypercalcemia episode such as severe abdominal pain, there's anorexia, there's nausea, there's vomiting, there may be associated of psychic depression, and there may be a pathological fracture. Sometimes just the history of trivial trauma resulting in a fracture, and once you start diagnosing it comes out to be a pathological fracture. So it could be a localized pain due to bony metastasis, or it could be due to a pathological fracture, or it could be anorexia and nausea. Patient may have a complaint of abdominal pain and depression. These are the features could be mixed. It could be associated of simply of hypercalcemia, or it could be associated features of malignancy plus hypercalcemia. The patient may present with a pathological fracture. They simply may present with fatigue and muscle weakness. So when we are investigating that, we need to rule out how much is the serum calcium level, what is the state of phosphorus, and what is the levels of PTH as well. Investigations need to be directed towards lungs as well, because we know that the most common solid tumors of lung mainly present as a hypercalcemia. So we need to get a chest X-ray, we need to get CT of the chest as well. Similarly, we need to rule out, get an abdominal CT as well to rule out abdominal causes which may be causing hypercalcemia. Then yes, need to get a scintigraphy of parathyroid gland as well. Entire chest, abdomen and pelvis. Skeletal survey or nuclear medicine bone scan, basically to rule out whether the hyperfunctioning parathyroid glands are not. And myeloma screen is actually done by using serum and urine electrophoresis. And in urine, we usually find high levels of Benz-Jones protein, which is indicative that patient has got multiple myeloma, which is actually causing hypercalcemia in this patient. Acute treatment is directed at similar for acute hypercalcemic episodes. Give them fluid, give them steroid, and give them IV bisphosphonates. Once that is done, acute episode is over, then we need to work up the patient for causes of hypercalcemia. And if we know it's either bronchogenic CA or lung, then we need to treat the underlying cause. If its underlying cause is some kind of a bony tumor, we need to treat underlying that way. It may be a combination of radiotherapy, chemotherapy, or a surgery. Depending upon what's the underlying cause, that is how we need to treat the underlying problem. Intravenous fluids and bisphosphonate glucose for acute episodes. Management of the underlying malignancy can resolve hypercalcemia. Local radiotherapy can provide relief of pain and hypercalcemia caused by local bone resorption. So in this section, we have gone through a very important topic, that is hypercalcemia malignancy. Certain malignancies present with hypercalcemia, and actually the first time the patient realizes that he or she has some kind of a malignancy is when he or she presents with an acute episode of hypercalcemia in the hospital. Acute management includes, that is, they are dry, give them fluids, IV fluids, IV bisphosphonates, and IV steroids. Then work them up for what was the cause of hypercalcemia. It may be due to underlying solid tumors of the lungs, such as bronchogenic CA. It could be sarcoidosis, tuberculosis, histoplasmosis. It could be multiple endocrine neoplasias. It could be multiple myeloma. It could be lymphoma and certain other tumors. Then you need to perform all the tests. What is the causing hypercalcemia? And once that is diagnosed, what was the root cause of the hypercalcemia, then the treatment is actually directed at the root cause. Rule out that cause first and treat it accordingly. Thank you very much. Keep watching sqadia.com.